to talk about the management of stress and anxiety. Stress and stressors, anxiety, breathlessness cycle, and strategies to cope. Stressors are events or situations in everyday life that require change. Everyone has stress in their life, and it's important that we manage this in a positive manner. Stress refers to the physical and psychological reactions that a person experiences when faced with stressors. What are these stressors? They can be personal, which could be someone having a personal illness. It could be a change in financial status. It could involve work, daily activities, and environmental issues. Changes in ability to perform activities of daily living, loss of a job, disability, leave, or retirement. It could involve family and social networks. We all have stress in families and sometimes with our social networks. It's important that we recognise separation or divorce could be one of our stressors, illness or death of a relative, and conflict with family members or friends. So let's talk about stress reactions. Fear is a normal reaction to a present danger. It may be something as simple as crossing the road and a car comes along and we have a feeling of fear. This is normal. Anxiety is a reaction that involves constantly worrying and anticipating stressful situations. Panic attack is an exaggerated, irrational, and often sudden fear or anxiety reaction. So it's important that we clarify the difference. An example, a man suffering from a respiratory condition suddenly becomes seriously ill and he is unable to breathe. He calls an ambulance to get to the hospital as soon as possible. Example of anxiety, a woman suffering from a respiratory condition has had a very severe reaction of shortness of breath during an outing in the park. She starts to avoid all outings. So we have the three stress reactions: fear, anxiety, and panic attacks. It's important to think about stressful situations, and whenever you have these situations, do you have negative thoughts? How does your body react when you're anxious? What do you do when you're anxious? What is your behaviour? And to think about actions in the future that could help you cope better with this situation. It's important to understand the anxiety breathlessness cycle, and this is something that we hope we can break. The main symptom of respiratory conditions is shortness of breath. Shortness of breath then in turn can cause anxiety and can cause panic. Anxiety makes you breathe faster, which increases your shortness of breath, and as a result you become more anxious. Many respiratory sufferers choose to stop doing any activities of daily living. And really what we want is to stop that cycle, because it's very negative and it does not allow a good quality of life. This is the anxiety breathlessness cycle, and this is what we hope to break. Whenever you have a respiratory condition, you have shortness of breath. Once you have shortness of breath, it can lead to anxiety. And then once you are anxious, it can lead to further shortness of breath, which in turn can lead to an individual deciding they are not doing any activities of daily living. So this is what we want to stop, and it's really, really important. And I'm sure everyone can identify with that. So we want to learn how to cope and to break this cycle. It's important that you recognise and understand your anxiety, It's important to maintain a positive attitude. It's important to plan your actions in advance. And most important, I think, is to try to solve one problem at a time. And it's okay to make mistakes. I often think of a young child, perhaps 3 or 4, and they see a puddle of water. What do? They don't walk around it, they jump in it. So it's about enjoying the very essence of today that you are living. It's important you have fun. It's important you identify the things that make you feel good. It's important that you prioritize things in your life. It's not important to clean your skirting board every day, but it is important to go and see your friends, to go out into the garden, smell the roses, drink coffee, and have fun. Do things you enjoy. Use humour. Humour is the best medicine in the world. We all love to have a good laugh. We all love to have fun. And it's important that we learn to relax as well. If you're always anxious, just think of the state that your body is in constantly. So if you feel uneasy, ask questions and find answers. Remember, you are all extremely important individuals and you have a right to ask what is relevant in your life. Some things that can make respiratory symptoms worse are things like indoor pollutants, and we want to avoid those best we can. Obviously, cigarette smoking. Outdoor pollutants could be the fumes of the cars. So really that you want to try to avoid them best you can. And emotions, which are so important because these are anger, anxiety, and it's best if we can't always avoid them, but we can try our best. An example of that, if you constantly meet a friend who is always complaining and negative, probably good idea not to see that friend so often. Other common factors can be changes in temperature. And quite often respiratory patients will say, oh, that took my breath away, the cold, or in a very warm day. So it's to keep things in moderation. Other suggestions to reduce or avoid exposure would be obviously quitting smoking, and really don't allow people to smoke around you either, and avoid secondhand smoke. Avoid strong odours. Some respiratory patients will say certain odours, that took my breath away. That could be things like hairspray or deodorant. If you're stressed and you need to talk with your friends and family about your feelings. You're all important people, and just because you have a respiratory condition, you still have the right to express your feelings and your emotions. And it's also important to practice breathing and relaxation techniques.